Hello, everyone. Welcome to Conversations with Sekani, a podcast for people in their 20s who are trying to figure out life and not get lost along the way. Today's guest is Kelly E. Shitz, a licensed mental health therapist who specializes in treating PTSD and obsessive compulsive disorder, OCD. With nearly a decade of experience, Kelly combines professional expertise with a deeply personal story of survival. She's passionate about breaking the silence around trauma, raising awareness about domestic violence, and giving a voice to stories that are often overlooked, especially in her home region of Central Appalachia. Kelly, welcome to Conversations with Sekani. It's a pleasure to have you on.
It's a pleasure to be here. Thank you.
All right. So, yes, Kelly, I want you to take us back to your 20s, right? So, I'd like
hmm
to ask, when you think back to your 20s, who was Kelly during that season of her life?
Oh, wow. I I was searching.
Hmm.
Um, I was doing a lot of searching and figuring out what it was that I wanted to do. And around my mid 20s is when early, like I would say 22 to mid 20s, I graduated, with my bachelor's in psychology, clinical psychology, minor in sociology. And then I became a lab manager of uh, neurology, or excuse me, neuroscience lab, brain computer interface laboratory. And so um, my 20s was spent or were spent developing my love for research, my love for psychology. And during that time, I reconnected with um, the man who would eventually become my husband in my 30s. We dated in high school. Um, so a lot of searching.
Wow. All right. Like you said, a lot of searching, right? So,
Mm.
looking back, what would you wish that your younger self had known about healing?
Oh, that's a great question. Grace.
Hmm.
I wish that my younger self would have known that healing requires grace and that it's not linear and it's okay to be messy. Uh, there are so many, like, this culture that we have right now of toxic positivity is such a terrible one. And,
Hmm.
you know, in order to heal, we have to be messy because we have to address the things that have hurt us. And the things that have hurt us, that have traumatized us, wounded us, are not clean. And in order to move past them, we have to get into that mess and allow ourselves to feel it. And I wish that I would have let myself do that sooner.
Wow. Honestly, Kelly, thinking about what you just said, right? I'm thinking, and I want to ask, right? Do you think it's possible to heal? Because I remember speaking with a guest that said, he doesn't really think healing is like possible. I mean, healing totally, right? You have to learn to live with some kind of events, right, that happen in your life. You have to learn to live with the trauma, but you might not be able to fully heal. What do you think about that, basically?
I agree.
Hmm.
Um, I do agree with that. There are things in life that happen to us um that I think we just carry with us. I have
Hmm.
a running joke that I would like to just, you know, basically like punch the person that said that time heals all wounds because that's just not true. Um,
Um,
there are things that happen to us that are just so like traumatic that are, and when trauma happens to us, it changes the topography of our brains. And we we don't always completely heal. What we do is we learn to manage around it. We learn to live around it. We learn how to accept and manage and overcome. But do we ever forget it? Probably not. Um, so I guess it depends on a definition of what a person wants to say is healing. To
mm,
me, based on my trauma, have I healed? Yeah, some. Will I heal completely from what has been done to me? No, probably not. It's changed me entirely. Will I carry it with me forever? Sure. But does it have to affect my life in a negative way forever? No. I can learn how to manage the symptoms of PTSD. I can learn how to manage my life around it so that I have an excellent, good quality of life.
wow. Whew, all right. So I really needed to, clarify that, right? And like you've said, we have to learn how to manage it and manage the PTSD in a way that it doesn't affect your life negatively, right? You could,
Mm-hmm.
right, just randomly remember events and just, be able to just get out of it instead of now drowning back in depression and anxiety. Right. So,
Exactly.
mm,
And that's where therapy comes in. I think therapy is one of, if not the best tool for someone who has dealt with trauma, grief, something that has just shaken their world. You know, you may
mm,
not ever fully heal completely from the loss, but you don't have to let that consume you. And that's the most important take home. You know, it whatever happens to us in this life doesn't have to consume us.
mm,
It may stay with us. We may carry it with us on some level wherever we, for the rest of our lives, wherever we go, but we can live a great life, using tools that we learn in therapy and moving forward.
mm. Whew, okay. So at least this one made me, feel better knowing that, it's actually possible to, move forward, learn to live, enjoy life regardless of what you've been through, right? So, yeah,
Absolutely.
absolutely. And now I want us to dive into what you're doing today. I'd like to ask, right, what inspired you to become a therapist?
Um, Honestly, uh, I have studied, ironically, PTSD since I started college. So for my entire bachelor's and then my master's, I studied combat related PTSD. My dad is a Vietnam veteran, and I don't know if it was entirely him, but probably. And most people say they just wanted to help. I'm a researcher at heart. I just wanted to learn. I wanted to understand, and I wanted to figure out the mechanisms at work. And to me, it's like I was speaking with a client um earlier today, and I was like, it's like, you know, a puzzle. We all have what I call alphabet soup. I think we all have our own mental health struggles that comes with diagnoses. I have mine, and I like to look at diagnosing as a puzzle. We put the pieces together, we figure out what's going on, and then we figure out the appropriate treatment. And that's the researcher in me. And then the therapist in me, which is actually, the human in me, um, meets people where they're at. And then we come up with a way of helping heal that problem, work through that problem, cope through that problem or problems, whatever it may be.
Wow. Oh, all right. So, you now specialize in PTSD and OCD, right? So, first of all, I'd like you to explain what is PTSD and what is OCD, and what are some of the biggest misconceptions people have about these conditions?
Oh, yeah, great. Um, Full transparency, I have both.
Mm,
Um, PTSD is something that people typically can or do develop, not everybody, but there are outliers, but develop after a trauma or multiple traumas. Um, and it's just it change like I said, it changes the topography of the brain and the amygdala where the fear center is, it's primal fight, flight, freeze, fawn, flop, we go into that fear response. It kind of enlarges, the hippocampus shrinks, that's involved with memory and, processing to the prefrontal cortex kind of is a little bit jacked up. There's more involved in that. I won't get into it, but the brain is just not processing things the way that it normally would. It's processing things as though there is a threat present, even if it's just a perceived threat based upon the trauma that's occurred. And so the person that is diagnosed with PTSD, and there's a new buzzword called complex PTSD, which is not actually a diagnosable um, illness at this point, at least in the DSM-5, but all it really is talking about is um, layered traumas upon traumas upon traumas, because people rarely have a singular trauma. Um, what is happening is that their body and their mind are responding to what has happened to them. So, they may be having flashbacks, they may be having nightmares, they may be, you know, avoiding at all costs, talking about, thinking about, going around things that remind them of what happened to them. Um, Emotional, like, aspects change. So there may be an increase in like feelings of negative emotions, a decrease in feelings of positive emotions, feeling disconnected from people, feelings of disassociation, um, hypervigilance, easily startled, difficulties in concentration, difficulties in sleep, you know, increase in self-destructive behaviors. And that's just to name a few. And all of these are just responses to our brains on trauma, because our brains were not really created, we're not really made to handle combat, repeated abuse, rape, sexual assault, you know, first responders seeing all of the things that they go through on a daily basis, just any of those things. There's a whole host of things that can be considered and are considered traumatic. And I am personally of the opinion that trauma is relative to the human. Um, we all determine what is traumatic to us. Our brains determine that. And so PTSD is essentially that. It's a response to an overload of trauma, and it just tries to protect us. Our brains are basically just trying to protect us from that and save us from a perceived threat. OCD, obsessive compulsive disorder, is not what people typically tend to think that it is. So, it's become a buzzword. Oh, I'm a bit OCD. Um, Probably not. OCD is very debilitating, just like PTSD. Both of them are considered neurodivergent. OCD brains are different in that they process information differently. Um, it's not always about keeping, your house very clean. A lot of times it's very debilitating. Um, Essentially, your brain is flooded with intrusive thoughts or fears or images, or you are hyper focused on somatic things like breathing, heart rate, or you feel like you have to have everything symmetrical. There are different themes, for instance, and they get stuck, for lack of a better term. They're sticky thoughts, and they cause great distress. And so, in order to relieve yourself of that distress, you develop a compulsion that helps mitigate it for a little bit, creates relief. But what it's really doing is creating a cycle. And it just repeats itself and it gets worse and worse and worse. So, a good example would be, you know, one day you're standing in your kitchen and you're chopping up cucumbers, and all of a sudden, for no reason whatsoever, you have a thought, why don't you just go stab your husband? And you're like, oh my God, why would I think that? I don't want to do that. I'm not that kind of person. And you don't want to, you're not gonna, but it's so against your value system. We call that ego dystonic, that it scares you so terribly. You start avoiding knives, you start avoiding your husband, you develop rituals that, you won't, maybe you knock 3 times on the counter before you pick up any kind of cucumber. I mean, it can get really out there, to be fair. Um, I've worked with people who haven't left their house in like 2 years sometimes because of it, uh, just because they are so afraid of what the underlying core fear is under the what if initial thought. So it's highly misunderstood. A lot of people are afraid to talk about those thoughts because they're afraid that people won't understand that they don't actually mean them. But they're also afraid that because they have these thoughts, that it means something about them, and they don't realize that we don't control our thoughts. Thoughts float through our head like clouds do in the sky. And I'll, I would say probably most of us have thoughts like that don't get stuck. We just are like, okay, whatever. What, that's ridiculous, whatever. And we go on with our day. But people who have OCD, some of those thoughts get stuck on repeat and they get louder and louder, and they start to compulse harder, and it can really affect their life.
Mhm. Wow. Oof. Figure. I'd like to ask, right? Why do you think many young people actually, let's say, choose to, suffer in silence, right, from these things? Why do you think it's difficult for them to ask for help?
Um, Cultures, for one, like where I'm from in central Appalachia, we just don't like going to the doctor.
Mhm.
And we also don't like, admitting that there's something wrong. But in the case of OCD specifically, people are afraid that if they come to And I've seen this happen before to if they seek help with someone who's not familiar with OCD, they're going to get, admitted into a hospital because the person's going to misunderstand and think that this person has, suicidal ideation or homicidal ideation, or that they're, you know, having hallucinations when they're not, and they're not getting the right treatment. So they would just prefer not to speak. With the PTSD, veterans specifically or first responders don't speak up because, they don't want to lose their point, like their position. They could lose security clearance. Our society has not made it easy for individuals in certain jobs to say, hey, I am having some mental health struggles. Can I get some help without, their job being affected? Which is absolutely ridiculous if you think about it, because you would want your people in certain jobs to have the best mental health care possible so that they can continue doing the best job that they can do. So, a bit of culture, a bit of stigma, a lot of stigma actually, and fear.
Well, like you said, some 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 of the reasons is culture, right? Then stigma and also fear. Oh, okay. So I would like to ask, right, how can, should I say, family or friends better support someone who is dealing with trauma or mental health challenges?
Uh, you know, I think without judgment, openly just listen. Don't put any kind of value judgment on it. Don't take it personally. Let the person talk. Be gentle. Guide gently if needed. If it's serious, help them get to an ER. If you have to, call in wellness checks. But most people, if they feel like they're heard, I would argue, are more apt to, you know, listen and go with suggestion as long as they feel like they're heard. Because a lot of people who are going through things like this will say over and over again, I know that doesn't make sense, or I know this sounds crazy, or I know I sound pathetic. I mean, I hear that all the time, and I'm a therapist, and I'm like, brother, sister, I get it. I do. I have my own. Um, but it's still such a stigma that just feeling heard and sitting with people who are not judging you, who are not placing any kind of value judgment on you, who just legitimately want to hear what you have to say and not try to fix it because you can't. You know, they just honestly want to hear what's going on and then help you figure out. And that's the key, help you figure out what's best for you. And if it's a situation where that person maybe doesn't have the capacity to figure out what's best for them, getting them some help by calling like 988 if it's a suicidal ideation or something, or, helping them get to a hospital. About being
Mm.
kind.
Oh, all right. So, yes, thank you, Ken. Honestly, this has been amazing, and I get to learn a lot, right? Well, finally, I'd like to ask, what advice do you have for anyone who might be in the situation where they know that there is something wrong, right? They're probably having some mental breakdown, mental health issues, but they're actually so afraid to speak. Because we've touched on one of the reasons why they are afraid. So what can you advise someone in that category to do, in order to come out of that shell and finally seek help?
Oh, that's a great question.
Mm,
Um, Somebody out there will understand you.
mm,
I promise. And if they don't, keep looking. Do not give up. If you do not feel like you are being heard, keep talking. Keep going somewhere. You don't have to tell everybody everything. There are ways of going about talking about some of the things that might be going on in your head that can help you suss out whether or not a person is safe to talk to, that you feel comfortable talking to. Just don't give up because you've met maybe you might have been placed with not a good fit of a therapist. You can ask for another. That is something that I have heard over and over again. People say they were matched with the wrong therapist and they didn't feel like they could
mm,
ask for another. Find another. You have agency. Don't give up. Keep trying.
mm. Oh, like you said, don't give up and keep trying, right? At the end of the day, we all will, finally get the healing, right, that we deserve. And so thank you, Kel. This has honestly been amazing. And yes, it brings me to the final segment of my podcast. I call it the rapid fire segment. So
Okay.
you could, right, you could either answer with a word or a phrase starting now. So what is one book every young adult should read?
Oh, 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 oh. The Tesseract by Alex Garland.
Hmm. Wow. Ooh, okay, so what is one self-care habit you never skip?
I never skip loving on my dogs.
Wow. All right. So what is one word that describes hope?
Faith.
Hmm. And finally, in one sentence, what does healing mean to you?
Healing means that I am finally becoming unburdened.
Wow, that is deep, I would say. Finally becoming on board in. Wow. All right, so thank you, Kel. This has honestly been amazing. And finally, before you go, where can listeners get to learn more about you and also, you know, connect with you?
I have a website, www.kel1lsheets.com. I also have a podcast wherever you can find it. It's on all the podcasts. It's Hell Billy, The Darker Side of Appalachia. And it's on Spotify, Apple, all the places, and on Substack.
Mm. All right, wow. And I'm gonna put the link in the show notes so it's easily accessible for listeners. And to my listeners, I would like to say thanks for tuning in to Conversations with Sekani. If this episode sparked something in you, just as it did in me, make sure to share to someone you think might need this and also subscribe so you don't miss out on new episodes. Once again, thank you, Kel. Do have a wonderful day ahead of you.
Thank you. It's been great.
Oh, thank you. Take care.
You too.